Hi, Edward?
Yes.
Hi, I'm Ophelia Garcia. I've been speaking to you in the last couple of days.
Hi. How are you?
I'm great. How are you?
Okay.
Um,
So
can
yeah,
you...
you have a bunch of questions.
Yes, can you please state your name and what you do at USC?
Sure. My name is Ed Avol, A-V-O-L. I'm a professor in preventive medicine at the University of Southern California. I do research into understanding the long-term health effects of air pollution, both in respiratory and cardiovascular endpoints. And I also teach in the undergraduate environmental health program to teach students about issues of air quality, water, soil, all the issues associated with environmental health.
Okay, thank you. So my first question is, air pollution is known to have damaging effects on the human body. What are some of those effects?
Well, the effects really range from sort of short-term, what we might call subclinical, that is, they're not bad enough to get you to the hospital or anything, but they are irritating, to actual mortality. So yeah, they run the gamut of all organ systems from respiratory, that is, you breathe the pollution in, the cardiovascular, affects your heart, to neurological, affects your executive function, your motor coordination, your ability to learn, your capabilities, sort of thinking and processing. It affects your metabolic system. And so there's a whole range of things. There's even recent data has come up that shows that air pollution is associated with obesity and even diabetes. And so there's a very wide range of negative health outcomes associated with exposure.
Okay. My second question is, Los Angeles has the worst air pollution in the country. Is there a relationship between mortality rates and the pollution?
Yes, I mean, there's been a lot of work done. There are thousands and thousands of studies looking at the long-term effects of air pollution on human health. And some of those do suggest associations between air pollution exposure, particularly particles, those small pieces of dirt floating in the air, as well as certain gases, such as ozone, have been associated with increased hospital admissions, increased cardiovascular and respiratory disease, and increased mortality associated with cardiovascular and respiratory disease.
My third question is, how does the human body react to the exposure of air pollution?
Well, again, it sort of affects all the organs. So, when we think about air pollution, we think about it, we breathe it in. And that's certainly sort of, in some sense, the first sort of interaction with the body. So you breathe it in, but it does, some of the pollutants are deposited in the airway, some of them cross the air-blood barrier in the lungs, and once they get into the blood system, they really can be transported anywhere throughout the body, just as your blood flows most everywhere throughout your body. And so it's not that surprising that we see effects in all sorts of organ systems. But the kinds of effects that we see initially are inflammation, swelling, potentially some immediate site damage. There may be an effect right at the area that first is impacted by the pollutants, if they're particles or interacts with the gases. And then that may basically disrupt or change the normal function of the cells, and that can lead to other downstream consequences if they continue.
My fourth question is, are there any birth defects associated with harmful chemicals in our air?
Yeah, there's been a lot of work done at UCLA, among other places, looking at some of the issues in early life development and exposure. Now, we've seen associations for various pollutants with early birth, preterm birth. We've seen it with some low birth weights, and both of those have impacts in terms of the child's development later on in life and potential health problems later on in life. There's been some suggestion of defects in terms of valves in the heart and other sorts of formation issues. And again, because what's happening those 9 months of development for the fetus before the baby is born, exposures during that time frame can be very important because they do affect the development of the child throughout its life.
My fifth question is, how do smokers' lungs compare to the lungs of someone that has lived all their life exposed to high amounts of air pollution?
This is a pretty common question. People always want to know sort of is it equivalent to smoking a pack or two of cigarettes or something like that. It's sort of usually the way the question is phrased. It's hard to quantify it. It's just a breathing a day or breathing a year with air is equivalent to smoking a cigarette or packs of cigarettes. The kinds of damage are similar, but the chemicals are different. There are hundreds of different chemicals, about thousands of chemicals in the air every day, and there are hundreds of specific toxic chemicals in cigarette smoke, for example. And you might think of cigarette smoke as your very own personal air pollution because it's just inside your chest cavity, just inside your lungs. So some of the kinds of damage are similar in terms of irritation, inflammation, in terms of long-term exposure to cigarette smoke or to air pollution. We get, again, cardiovascular disease, respiratory disease, some of these other issues. And we know now from years and years of studying tobacco, the negative effects in your heart, your lungs, your blood pressure, your tumor growth, cancer, chronic obstructive pulmonary disease. So a whole long list of bad health outcomes of smoking. And many of those are also similar sorts of outcomes that we see from air pollution. But you might think of air pollution in general as sort of a much more diluted form than smoking, but it affects many, many more people because many, many more people breathe the air, even all of us, every day compared to the smaller number of people who smoke. Although there's still too many people who smoke, and those people who do smoke typically will have negative health outcomes.
Well, I'd like to thank you so much for helping us in this project. We really appreciate it.